Yeah, it just depends on how fast you guys will be answering these questions. If you answer them very fast, we finish early. If you decide not to answer them, which is still very much okay, we shall try to answer them together. Okay, so now you know my name, and tell your friend, if you can't see your friend in the meeting, they are probably sleeping. Tell them to join. They will join. You don't want them. We don't want them here next year. We want them to come to Kenyatta. We don't want them here. Okay. Or maybe they already have the enough content. So maybe do not disturb them. Okay. So the scope for today, I'll keep it easy as you instructed me. I should focus on all the three parts. So gross anatomy. Okay, now the pen is misbehaving. Okay, shall do the gross anatomy of the limbs, upper limb, lower limb. Probably one question for each. It would be said I can't cover the whole scope of anatomy in one session. That is practically impossible. I tried that last year and it did not go very well. So I shall just be touching on some important things. Maybe have your pen and paper ready so that when I say some things which I have not covered and they are testable, you write them down and maybe go through them. Then we shall go to the head and neck, neuron heart, the thorax. In the thorax, we shall majorly focus on the heart and the lungs, but that does not mean that you should not know about the other contents of the mediastinum. You should know them. Then the abdomen, we shall majorly focus on the liver, spleen, kidneys. That does not mean that we should not focus on the bowel or the GIT tract. You should also focus on it because you can be given a question and on that. There will be a question on the GIT viscera. The question will come from there. Then the pelvis and the perineum, we shall use the hemipelvis as a guide to study the anatomy of the pelvis and the perineum. Then histology. For histology, I have obtained some good images. We obtained these images last year with Haron, Sami. We obtained them. We obtained them from the department. We took the slides from the department. We took some photos. I remember we would even stay the whole night at the department taking those photos. We compiled something, and I have obtained some few images from the images we were able to get there. So I'll be sharing with you some questions. As you know, you had expected even to know those slides, because in your exams, you are given those microscopes, and that is why I see most of you struggling because you say you are not seeing anything, and there is something to be seen there. Then embryo, I'm sure you guys, we have gone through embryology with you guys very, very many times. So that one will be just a walkover. Eh? Okay. So you should be even typing in the chat box the answers. Guys, where are the answers? Identify the type of epithelium and give reasons for your answer. Let me open the chat box. Guys, identify. This is one of those slides I'm telling you we took at the department. Yes, this is, if you go to the department, you'll find this slide. Very good. I can see answers are coming in. I see answers are coming in from Emily, Disencephaly, Zinle. Very good. Yeah. Yes, this is a transitional epithelium. I agree. And what is the why? Why have you named it transition and not stratified squamous or stratified whatever? Very good. So I can see one answer is coming. Umbrella, dome-shaped cells. Very good. Very good. Yes, I can see the answers are coming in. Very good. The apical cells are dome-shaped. Very good. Yes. Uh-huh. So I think you guys are good with that. So it's the transitional epithelium, also known as the urothelium. Vary number of layers, oh, but the characteristic feature is those dome-shaped or umbrella-shaped cells, the apical surface. Okay, let me see if I can see one here. Hmm. Okay, they are somewhere there. That is the transitional epithelium. So where do you expect to find this guy? Ah, I can see already you have the answers. The ureter, and the renal pelvis, urinary bladder. Where else? Apart from those three, minor calyces, very good. Where else? Minor calyces. Where else? The major calyces. Okay. So we have very many areas. You should know that. Then what are some functions? Yes, what are some functions? What are some functions? What are some functions of this epithelium? One, distension. Okay, so it allows for distension, protection, and also it's impervious to urine. Okay, I think that question was very easy. I think that question was very easy, and you guys were able to tackle it well. So please just go and remind yourselves the different types of epithelia in the human body, and um, know their function and location. Know their function and location. If you can be able to do that, I think you'll be at a good point. Yeah, remember, epithelia is one of the four basic tissues. So these are basic things, and basic things, you must know these things. Hmm? Epithelium, these are just free marks. Free marks. If you cannot answer this one, now you are in a bad place. Okay, this is a must know. Okay. Question two. Yes. What is A, B, and C? What is A, B, and C? Yes. What structure is this? A there, B, and C. Uh-huh. Guys. Okay. So I can see C spinalis. Okay. C is spinalis. Okay. I think we can write it. Spinalis there. What is B? Very good. B is longissimus. It's double S. No. I have a feeling I've missed longissimus. One of those two. Well, I can't recall where was the double S? Okay. Uh-huh. A is idiocostalis. Very good, idiocostalis. Very good. So A is iliocostalis. So what is the collective name of those three guys? Those three guys are the erector spinae. Okay. The erector spinae. So erector spinae it's a composite muscle, three muscles in one. The lateral component is the iliocostalis. The intermediate component is longissimus, and the medial component is spinalis. Okay, great. Yeah, if you can remember that, then you are fine. Please remember the muscles of the back. Uh, which layer is the erector spinae of those four layers of the back? Which layer is erector spinae found? Superficial. Yes, thank you, Joy and Micah. The intermediate, Remember, you have four layers. You have superficial, You have a superficial, where the superficial one has splenius, those muscles which are known as the splenius group of muscles. So splenius capitis, splenius cervicis. Then we have the intermediate. The intermediate, now this is where you get the erector spinae. Then you have the deep. The deep one, you have the transversal spinalis group of muscles. And then you have the deepest, the deepest. So for the third question, with an example, which muscle group would you expect to find deep to the muscles above? So deep to it, this is where you find the deep group of muscles, and they are collectively known as the transversal spinalis because they are attached to the transverse processes of the spinal, so the spinal vertebra, okay, or the spine. And examples include rotatores and multifidus, okay. So I think we are done with that. So before I move on, maybe, okay. So let me see. Okay, which muscle is this? If I was to name this D, which muscle is that D? Yeah, this one. Which muscle is that? Which muscle is that? D. Very good, eh? That's infraspinatus, okay? That's infraspinatus. And please remember, when you talk about infraspinatus, please remember the rotator cuff muscles, okay? The rotator cuff muscles, okay? And if that is infraspinatus, by now you should know this is the medial border, the vertebral border of um, the scapula. So which muscle is attached there? The point where I've pointed. So E. Which muscle would you expect to be attached there? Which muscles would you expect to be attached there? Point E. Yes, yeah, the major rhomboid, okay? Rhomboid major, very good. Which muscle is this? This one. Let me mark it F. This one, yeah, that one. Which muscle is that? Latissimus. Is it? Is it latissimus, guys? If that's latissimus, then who is this? Now, G. Who is G? If F is latissimus, who is G? This one. Very good, Obed and Jeanette. Very good. Serratus anterior. F is serratus anterior, and G is now the latissimus. Okay. Please remind yourself about the attachment, the muscular attachment of the scapula. That one, some things occur so commonly that you will be tested. You should know the muscular attachments of the scapula. That one will be there. A question about the scapula will be, uh, you'll be asked a question about it. It's one of those uh, uh, skeletal structures which always make an appearance in your exams. Okay. Serratus anterior at the back. So what is the posterior attachment of serratus anterior? Where is serratus anterior attached? What is the attachment? The posterior attachment? Ribs. Yeah, medial border of scapula. Yes, it's attached to the medial border of the scapula, the inner part of the medial border. Anteriorly, it attaches to the ribs. Okay, please go read about scapula, okay? As you can see, it is giving you a headache. Please go read the scapula. No, don't go read. You have the atlas. Just open the atlas and see the Natus atlas, and see that shaded image there in red and blue, showing the muscle attachment, the muscular attachments of the scapula. You'll be fine with that. And you just know which muscle attaches there, its innervation and action. Great. Where is serratus posterior then? I don't think I can find it here. But the serratus posterior should be one of these these muscle fibers here, these are the muscle fibers of serratus posterior superior, which are just, they're usually, well, how are they attached? The lower, was it C6, C7, T1, T2, then they attach to the ribs. I really can't recall this. It's been a while since I went through the anatomy of the back, the deep anatomy of the back. Okay, so I think regarding the back, please, what I've not mentioned here is the innervation. Okay, which muscle is this? Let me use rim. Now this would be F, G, H. H, what's H? Which muscle is that? Yeah, that's trapezius, okay? That's trapezius. I've not said anything regarding the innervation of these muscles, okay? Please go and discuss the innervation. And so H, what is the, H is a derivative of what? If you are given such a question, H, I'll say A, B, and C. Very good, eh? Very good, eh? So the concept which I'm trying to deliver is that any muscles which are derived from the hypomere are innervated by the ventral rami. And the brachioplexus is formed by the ventral rami. So any muscle which is innervated by the brachioplexus, by default, it came from the hypomere. But now the muscles of the back, the true muscles of the back, let me say the true muscles of the back, because as you know, latissimus dorsi, its innervation comes from the brachioplexus, okay? So latissimus dorsi is a muscle of the back, but it's not a true muscle of the back, okay? Because it originated from the hypomere, it just migrated. But the erector spinae, it is a true muscle of the back, and that one came from the epimere, and it is for that reason it is innervated by the dorsal ramus, okay? The dorsal rami. So you just look at the innervation, and from the innervation you can be able to tell, was it from the hypomere or from the epimere, okay? Okay. What else did they ask about the back? The triangle of auscultation. I just go and read about it. Read about the triangle of auscultation. They might decide to give you a headache. Okay, I think I'm done with the back. Okay, we are back here now. So A, what is A? What's A? And the cartilage associated with it. So what is A? First arch, mandibular prominence, first pharyngeal arch, maxillary prominence, okay, first arch, Meckel's cartilage. So I'm assuming Meckel's cartilage is a cartilage associated with it. Meckel, okay. Is it Meckel's or Meckel's? Oh, Jockey, I don't think I think it's the well, I don't think I will bother you with the spelling for now. Meckel's cartilage, maxillary prominence. So that is the maxillary prominence according to some, according to others, it's the mandibular prominence. According to others, it's the first pharyngeal arch. Well, the first pharyngeal arch has two prominences. So those saying first pharyngeal arch, your answers are not specific. You should be on point. You should not be revolving around the point. You should be on point. So is it mandibular or maxillary? Because those are the prominences associated with the first pharyngeal arch. So nigani, which is which? So I can see maxillary, mandibular. So okay. So I think the mandibular guys have it. That's the mandibular prominence. Eh, Please note, this is the maxillary. Let me mention ABC. This E, that's the maxillary prominence. A here is the mandibular prominence, and these two prominences are part of the first pharyngeal arch. Okay, this, what structure is that? F, what structure is that? What's F? And by the way, expect such images in your otic, nasopit, nasoplacode, frontonaso, naso, optic placode. Thank you very much, Model. Thank you very much, Model. Optic, not otic. Optic. It's the optic placode, eh? Optic placode. The nasoplacode, the nasopit has not yet started to form at this stage, eh? The optic placode is the one which comes first, and then the nasopit will appear later on. Okay. Identify B. So what is B? Identify B and the adult artery associated with it. So what's B? Second arch. Okay, second arch. So what is the artery here? Very good. The hyoid artery. Okay, the hyoid artery. Okay, so it's the second pharyngeal arch. The stapedial artery is just a transient one, but in the adult you'll find that artery, the hyoid. So identify C and the stage 2 cell types within it. So what structure is this? What structure is C? Spinal cord. Thank you very much, Rosa Majak. Well done. That is the neurotube. At this point, it hasn't been a spinal cord. We cannot agree that your spinal cord is not the mature form. The adult form is the spinal cord. Okay, the derivative would be the spinal cord. Okay, would eventually form part of the spinal cord, but at this point, it hasn't been a spinal cord. Okay, so that's still the neurotube. That's still the neurotube. So what are the cell types within it? Which cell types do you expect to find within it? Okay, ependymal cells, astrocytes. Okay. Oligodendrocytes. Okay. Anything else? Ependymal, ectodermal. Hey, you guys are more than 150, and I can get answers from about 10 people. Only 10 people are. Where the rest? Simujibu bwana. You are sleeping, guys. So neuronal cells. Hey, I also wrote the spinal cord. Hapo ninaona hata mimi nilikuwa nimewatupa. It's the neurotube. Sorry for that. It's the neurotube at this point. Okay. And those are the cell types. So what is D? C. We have said C is a neurotube. C is neurotube. Umbilical vein, umbilical vein, umbilical vein. Very good, eh? And where does it terminate? Where does the umbilical vein terminate? Okay, it terminates to the fetal inferior vena cava. Does it? Does it directly terminate to the fetal inferior vena cava? Okay, so it terminates in the liver, where most of the blood within it is shunted via ductus venosus to the inferior vena cava. Okay, so we can say it's connected to the inferior vena cava by the ductus venosus. Okay, and what is the adult derivative? What is the adult derivative of this guy? Ligamentum teres hepatis. Hepatis, not hepatitis. Hepatis, eh? but we can overlook that. Okay, I think we are good with that. Um, so what structure is this? What structure is this pointed here? That structure. Can you please show where the first arch should be? Okay, the first arch, we say, remember the first arch? The first arch has two prominences, mandibular and maxillary, okay? So these two are prominences of the first arch. So there is the mandibular, okay? Sorry, maxillary, that's maxillary over there. And then this one, labeled A, that's mandibular, okay? The mandibular prominence usually feels earlier than the maxillary, okay? So A is mandibular, E is maxillary. The two prominences are part of the first pharyngeal arch. So what structure is that pointed by the very good, first pharyngeal clefts? Okay. So what are the derivatives? What is the derivative of this guy? Mastoid. Mastoid antrum. Tubotympanic membrane. Ooh. Ear pinna. Ear pinna. No, let us agree it's just one. It's the external auditory meatus. The ear pinna has very many. Remember, the ear pinna is formed from various structures, various hylux, okay? Various hylux come together. They fuse to form the ear pinna. Not all come, in fact, they are not derivatives of the clefts. They are more of they are derivatives of the arches. What about the outer layer of tympanic membrane? Okay, we can agree with that, but would you have the time to write outer layer of tympanic membrane? And there is always time to write just external auditory meatus, and you move on. Why do you guys? You don't have to make your life hard. Just if there is an easier option, take that option and move on. Okay? Yes, this is what our for MCQs. Okay, maybe for MCQs. Okay, I agree. I agree. Okay. But if it is sports marathon, just write the easier thing and move on. Okay? You don't have to make it very difficult. If the answer is just external auditory meatus, move. Just write that and move. Okay? External ear canal, move. Okay? You'll get the same marks as someone okay, who even wrote the outer layer of tympanic membrane. If you have the time, you can always write it. Okay. So please take your time, go through these images of embryology. Last year, they gave them a certain image. I think I have it here. You'll see it, and I'm sure most of you will be wowed by the caliber of that question. So these scanning electron microscope images of the fetus, you should also know them. They will bring, they might decide to also wow you guys. So A, B, C, D, E, F. Yeah, just name all. Just type the alphabet and tell us which one is which as we move on. A, chordoma, very good. B, occipito-encephalocele, very good. F, spina bifida occulta, very good. D, spina bifida cystica, very good. E, lachysticis, very good. C, anencephaly, very good. E, lachysticis, very good. Zimeisha. Okay, yeah, I think that's it. Then please go and know the anatomical basis. I won't talk about here, but please know the anatomical basis. Anatomical basis, okay? So like chordoma. Can someone tell us the chordoma? What's the anatomical basis here? What is happening? What is the anatomical basis of A? So persistence of the notochord. Okay, yeah. I think you guys are very much prepared. Okay, yeah. Now here's another image which we took from histology. So identify the structures shown. Which structures are these? What is the difference between acrania and anencephaly? Now, acrania is absence of the craniovault. So in acrania, the brain might be there, but the craniovault is absent. Anencephaly, the brain is not there, and also the skull vault is not there also, okay? So in acrania, the brain might be there, but the skull vault is missing. Anencephaly, both are missing. Okay, so the structure shown here, I can see you guys are very, see you have gone to the histology lab very many times, very good. These are the seminiferous tubules, very good. So what type of epithelium do you expect to find here? Very good, very good. Complex stratified, very good. What are the cell types? Yes, write as many cell types as you can, which you expect to find here. Leydig cells, Sertoli cells, okay. Myeloid cells, Sertoli, mood. Hey, what is mood? Does it have the stereocilia? No. Stereocilia are found in the epididymis. They have no business. They have no business in the seminiferous tubules. No business of stereocilia there. The stereocilia are in the epididymis. They have no business here. Spermatogonic cells, interstitial cells, okay. Spermatocytes, very good. Spermatogonia, you can see. So because of that, please go back. Can someone tell us what is the function of Sertoli cells in male fetus? Let me put it in a tricky way. What is the function of Sertoli cells in male fetus? Very good. No. Joy, hiyo tumekataa. No, Joy, no. It can't support cells for spermatogenesis. No. The fetus is not producing sperms. No, the fetus does not produce sperms. No, so it can't support. The function there, the function which I'm looking for is one, formation of the blood testis barrier. Very good. Two, production of mutagen inhibiting factor, and that is the most important. Secrete inhibin. No, at this time we have not yet started. The male fetus has not yet started. Okay, so the thing which I'm looking for here is if you tell me mutagen inhibiting hormone, stroke mutagen inhibiting substance, stroke anti-mutagen hormone. Now I know. Now I am very happy because now I can tell you have even gone through the embryology. Okay, so don't no. The male fetus has not yet started to produce sperms. The male fetus has no business to produce sperms at that time. Okay, so the function of supporting the sperm production will come on in adolescence. Okay, so in male fetus we just want mutagen inhibiting hormone. Okay, I think what else can be tested here? I think for the testes, for the histology, just know the functions. Okay. Yeah. What is the function of Leydig cells? What is the function of Leydig cells? Produce testosterone. Okay. Produce testosterone. Okay. That is wonderful. Yeah. Now, okay. I was to say that Please, because you have gone through these various cell types, please go back and discuss spermatogenesis. That process from formation of a spermatogony until you get a spermatozoa. Please be able to give a story, yeah? Be able to construct something, be able to give a flow of how the succession of these cell types until you get the mature spermatozoa, okay? Then, can someone remind me the three phases of spermiogenesis? What are the three phases of spermiogenesis? What are the three phases of spermiogenesis? No, no, no. Put them in order. Put them in order. The spermiogenesis. Put them in order. Put them in order. So whoever is typing, just put them in order. Those three phases. Spermatocytogenesis. Nisa Ali. No, no, no. Nisa Ali. No. The great. The great has it. Very good. No, no, Jeff. No, 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 Jeff. No. You are pana. The great has it. Very good. Very good. Very good. Okay. Golgi. Golgi. Yes, let me even, let me get my Kimani's histology and tell you which page you should go, because this question is often brought. I am looking for my Kimani's. Yes, it was around page. Let me tell you the page. Write this down and know those three processes, because as you can see, you have forgotten about this. Yes, it is page 175. The first phase is Golgi phase, then acrosome phase, and then that is the maturation phase. Anything else apart from that is wrong. So three phases. Spermiogenesis. Spermiogenesis, first of all, is the conversion of that spermatid to form a spermatozoa. Okay? So spermatid is a normal looking cell, that cuboidal cell, but you want to convert it. Now what is happening? You want to convert this cell to give you a spermatozoa. Oh my. Okay, you want to so imagine this is a spermatid. You want to convert it to form that sperm, that spermatozoa. This is the process known as spermiogenesis. Three phases: Golgi, acrosome, maturation. Anything else apart from that is totally wrong. Okay? And please know what are the, yes, once you say Golgi phase, what is happening actually in Golgi phase? That is that is what you should go and read. So hiyo naona that one, if that one would have been brought, you guys would be seeing dust. You would have seen dust, that one. Please go to page 175 and of your Kemani's histology and know what constitutes each of those. Okay. So what is A? And the state amaso attached to it. In fact, let us just say name two structures attached to A. What is A? Very good. Anterior superior iliac spine. Now, regarding whether short forms are allowed. Now, that one, unless you ask Dr. Tigera, okay? Please make sure that tomorrow, ask him, can you use short forms, okay? Please make sure you ask that question, okay? Don't, you might think, you might write ACs and the system decides to fade you, okay? So, anterior superior spine, I can see inguinal ligament, very good, sartorius, tensor fasciolata. Tensor fasciolata. Does tensor fasciolata go all the way? Okay, I'll stick to inguinal and sartorius. I am not so sure about tensor fasciae lata. Maybe you guys are the ones who know this anatomy. Maybe I confirm. You know, I'm still also learning. No, Messi, you can't say that mwache uongo. No, you know, you can't tell people to not say lies and you are not giving us your opinion. What is your opinion? You also tell us your opinion, okay? So tell us your opinion, okay? So I think most people have gotten that one. So I had asked Amaso, please, if you are asked muscle, stick to the muscle, okay? Stick to the muscle. If you are asked ligaments, say to the ligament. Don't, uh, if you ask you name the ligament attached there, you write sartorius. Wrong, okay? If you ask you the muscle and you tell us inguinal ligament, wrong, okay? So tell us what tell us what, follow the question, okay? Follow the question. Name two structures attached to B. So what is B? Anterior inferior spine, very good. Straight head of rectus femoris and idiofemoral ligament. Ah, very good, very good, very good, very good, very good. Okay. So what is attached here? That point. Let me name it E. What is attached there? The reflected head of rectus femoris. You just don't write reflected head. What reflected head of who? Yours. Reflected head of rectus femoris. Okay. Please give complete answers. Reflected head. No. Reflected head of rectus femoris. Not just reflected head. What is that? Okay. So what is C? What is C? What structure is this? What structure is C? Greater sciatic. Greater sciatic. A notch. Oh, some people are typing and then sciatic notch. Wrong. Sciatic notch. Wrong. It's greater sciatic notch. You must complete your answers, guys. Even you yourself, you are complete. Then why are your answers incomplete? Please, guys, to focus, eh? Greater sciatic notch, unapata full marks. Nobody will deny you a mark for saying greater sciatic notch. If you write sciatic notch, there is a lesser one. So which one are you talking about? Which one are you talking about? But it has been partitioned into greater. No. This is the greater one. The lesser one is here. The lesser one is there. The one pointed is greater. Okay? The one pointed is greater. Okay, I hope I have reminded you that greater and lesser sciatic notch are not the same as supra and infrapiriformic. Okay. Name structure about D. What is D? What is D? Ischiotuberosity. Very good. Ischiotuberosity. So which muscle group attaches to it? Which muscle group? Very good. Hamstrings. Very good. Hamstrings. Very good. Okay. I think that is wonderful. Okay. So before I go to that, so what is this? You know, sometimes you are given very simple questions in your exams and then you start overthinking. Eh. So what structure is this? Let me name it F. What structure is F? Acetabulum. Very good. Just keep it to that. Just say acetabulum. Okay? And you get your marks. Okay? And you get your marks. And then which type of joint does it form? Which type? Which type? Ball and socket, wrong, 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 wrong answers. I can just see wrong answers here. Ball and socket, wrong. The human body has only 3 types of joints: synovial, cartilaginous, and fibrous. Ball and socket is a variety of synovial joints. Ball and socket, that is not the type, that is the variety. Okay? Synovial. So what is the name? What is the name of the, what is the name? What is the name? What is the name of the joint? What is the name? Ball and socket. That is not a name. That is a variety. It's the hip joint. That is the name. So when it comes to joints, you are asked name, type, variety. Okay? Name, type, variety. Some of you are asked the name, you are giving us the variety. You are asked the variety, you are giving us the name. You are asked the type, you are giving us, I don't know your type. Eh? Guys, please stick to the question. Okay? Stick to the question. No. Ati ukiongeza zote. You don't have the time. You don't have all that time. Okay? You don't have all that time to write hip, synovial. No. Okay? You don't have that time. Okay? So please stick to the question. Just answer the question on spot. That is why it is a spot examination, on spot. Okay. So what is G? What is G? What is G there? Aha, very good. Very good. Eh? Obturator foramen. So what structures pass there? What structures pass there? Obturator nerve, obturator artery, obturator vein. Okay, wonderful. Okay. Okay, I think, see the other part of the hip bone, you'll go and discuss the other things. Finally, what structure is this pointed in red? What structure is that? Aha, that is the ischiospine. Very good, ischiospine. Now, can you tell me what muscle is attached to the ischiospine on the posterior aspect of the ischiospine? Muscular attachment, what is attached there? Superior gemellus, ischio-coccygeus, gemellus superior, coccygeus, superior gemellus. Superior gemellus. Okay. So nyote mumeagree ni superior gemellus. I can see ischio-coccygeus and very many other answers. All those are muscles attached to it. Fine. So what is the clinical relevance? Aha, pudendal nerve block. Okay, pudendal nerve block. So, okay, pudendal nerve block, because pudendal nerve is just within, the pudendal nerve lies posterior to it, okay? Just posterior to it. So use it as a landmark to locate that pudendal nerve and perform the nerve block when you are performing perineal surgery. Okay, now, I'm sure this question, you must have seen it somewhere. So what is A? What is A? Guys, what is A? Ulna. Ulna. Radius. Wrist joint. Radius. Wrist joint. Wrist joint is the answer. Full stop. Radius, ulna, wrong. Radiocarpal joint, correct. Radiocarpal joint, correct. Or wrist joint. Full stop. Don't think too much. Just look at where the arrow is. The arrow is pointing to the synovial cavity of the radiocarpal joint or the wrist joint. It's that easy. It's not a trick. Okay? Great. Then, what is B? Identify B. B is scaphoid. Scaphoid. Very good. C. What's C? Lunate. What is D there? What is E? Sorry, let me not use D. Let me use E and F. What's E and F? What's E? No. What's E? Triquetrium, triquetro, F, pisiform. Okay, F is pisiform. Now, is it triquetrium or triquetrio? E, triquetrium. Okay, we can agree with that. Then what was G? H? What is G? Trapezoid, trapezium, capitate, hermit. Could you please? Oh, sorry for that. Let me see what shouting colors I have here. The red might be shouting. Yes, G is that one. H is this one. What is G? G, capitate, trapezium, hermit. I think we can agree that you guys, kila mtu tu ako na jibu yake. Everyone has their own answer. Hermit, some are changing even answers. Eh? You are changing answers mbio sana. Hermit, I think Hermit has it. Okay? This Hermit, guys, couple, at this point, you guys don't know couple bonds and how they are arranged. Eh, at this point. Okay. This hour. See, let me leave it there. Let me leave it there. Okay? Please go and know the arrangement of the couple bonds. Be able to identify the couple bonds from both the palmar and from the dorsum. So, like this one is the palmar aspect. So, what if they give you the dorsal aspect? How would you be able to name the couple bones? Because on the dorsal aspect, you wouldn't see pisiform. Okay, guys, please, I will urge you, please just go to the internet. Just type radiological images of the couple bones. You will see very good images. They are labeled. Look for both palmar aspect and dorsal aspect. If you master that image, you are done. Points to note. They are named from the thumb. Okay, Matthias. Just depends on how you name them. Everyone has their own way of naming things. If you decide to name them from the thumb, okay. If you decide to name them from the small finger, okay. We just want the name. we do the department does not care how you named them, just the name. Wewe tuambie jina and we'll be very okay. So what is D? So what is D? First metacarpal bone. Yeah, wonderful, wonderful, wonderful. So which joint is this? What is that? If I could name it K, what is that? Si unaona? I have just asked the type and they are already telling me saddle. Yani, guys, kwani what am I saying? Kwani you guys, you just have decided you won't listen to me. Eh, yani nimesema tu hapa na hip joint, you have already inatoka automatic. No, hiyo mambo what do you mean automatic? No, then shift to manual. Okay, guys, the name. Okay, the name is the first couple metacarpal joint. Very good. That's the name. The type is a synovial joint. The variety is now. What is the variety? What is the variety? Hii sasa ndio inawatoka automatic. Aha, si unaona? Automatic saddle. So tell me two other locations where you find this joint variety. Which two other locations? Which two other locations? Sternoclavicular, very good. Patellofemoral, wonderful. Tarsals. No. Ni sternoclavicular and patellofemoral. Full stop. Okay. Sindizo hizo wajibu nimewawekea hapo. Haya, kuja hapa. A, B, C, D. Just name them. Just name what you know. What is A, what is B, what is C, what is D? Name, guys, very fast. So that we finish this thing. You know, we are in question 10 and we are already 1 hour done. D, surgical neck. D, auxiliary nerve. Hapana hiyo. No. Neck of humerus. D. Which neck? Which neck? Which neck? We will ask you that one. Which neck? Because humerus has two necks. A, transverse humeral ligament. Transverse humeral ligament. A. No. D, surgical neck of humerus. Yes. Mambo ya D tumemalizana nayo. Now we go to the others. What is A, B, C? A, teres minor. Hiyo tu. C, coracoid process. C, acromion. Rosa. Wonderful. B, glenohumeral ligament. No. A, teres major. No. A, subscapularis. Wonderful. Mzuri sana. B, A, pectoralis major. No. Kwani mumeacha kujibu? Guys, hii nayo imewashika hii. And mind you, these questions, I've just got these questions from last year's paper. So these are testable questions, okay? Don't think I have just gotten them from BSc Drive. No, these ones are from the previous groups, okay? So A, teres minor. B, infraspirators. C is the acromion and D is the surgical neck. In fact, what you are looking here is not the anterior aspect, it's the posterior aspects of the humerus. It's the posterior aspect. Haya. Ni sawa. So remember the story of here what was being tested are the, do you know the position of the rotator cuff muscles, rotator cuff, okay? Because where the dark line is, ideally that is where supraspinatus should be. So supraspinatus tendon should be there. B infraspinatus, then teres minor, and then subscapularis is more anteriorly placed, okay? So this was in the previous slots, and you unaona hivyo, just the way you have answered, that is the same way they answered, eh? And this was one of those questions which was most failed. Okay. Name A, B, C, D. So sasa hii ni kuname. Name as we move on very fast. A, B, C, D. Guys, don't leave. You have started to leave already. Hey, B, Cistana magna. J, very good, very good. Cistana magna, B. Okay. Mbona mwanzi na A? Si mulipata A. Ni nini bwana? Mwanzo na A. Eh? Mwanzo na A, guys. C, suprachiasmatic cistern. No, no. You hapana. Quadrigeminal cistern. B, very good, very good. B, cistern magna, very good. A, pre-medullary cistern, very good. Or simply medullary cistern. Yeke just medullary cistern or pre-medullary cistern, very good, very good. C, interpuduncular cistern, very good, very wonderful. C is interpuduncular cistern. Okay. You have answered all. So which one is this? The one in green, somehow green. Which one is that? If I would name it as E. Very good. Pre-pontine or simply pontine cistern. Very good. So what do you expect to find within D? What are the components within D? What do you expect? What are the contents within D? What structures are within D? What structures are within D? Tectum. Aye. Tectum siko midbrain. Sasa itakuwaje structure sister? Wonderful. Great cerebral vein. Quadrigeminal bodies. Okay, they project there. Okay, they project in there. Basilar artery. No, no, no. Basilar artery. Quadrigeminal cistern. No, no, no. You are part. Great cerebral vein of Galen. Wonderful. Which other structure? Pineal gland. Wonderful. Wonderful. CSF is a content. Okay. But structure. No, CSF is not a structure. It's just a content. Choroid plexus. Choroid plexus. Anafanya nini kwa cistern? No. No. Choroid plexus ako kwa lateral ventricles na kwa fourth ventricles. No. Not in the quadrigeminal cistern. Arachnoid trabecular. Guys, kwani zimeisha? You guys don't want to tell me about trochlear nerve, eh? Ni sawa. You don't even want to tell me about trochlear nerve. Ni sawa. You guys also don't, posterior commission. No, no, no. You also don't want to tell me about the basal vein of Rosenthal. Ni sawa. Ni sawa. Okay. We have very many contents there. So, trochlear nerve, posterior perforating substance. No, no, no. That is a content of the interpuduncular cistern. It has no business with the quadrigeminal cistern. We are talking about contents of D. So in the quadrigeminal cistern, you have the great cerebral vein of Galen, the basal vein of Rosendahl, the pineal gland, the trochlear nerve. Four structures in there. Yeah. So what are the contents of now C? C, what contents do you expect to find within C? Yeah, this one is an easy one. C. In C, what are the contents? Oculomotor nerve, very good. Mammillary bodies, very good. Posterior perforated substance, very good. Cubosinarium, very good. Oculomotor nerve, okay. Infundibulum, okay. Okay. So guys, please know the various location. Circle of Willis, okay. Please know the various locations of the various cisterns and the contents. Let me leave it at it there. So name this cartilage, first of all. Which cartilage is this? Which cartilage is this? Hyaline cartilage, okay. So which type of hyaline cartilage? Where's the location of this guy? What is the location? Very good. Wonderful. This is a cartilage. Trachea. Aye. Trachea. Upate articular cartilage. No, no, no. The trachea does not articulate with anything. Your part, articular cartilage. So, what are the zones of articular cartilage? Name A, B, C, D, and also E. Name. What is A, B, C, D, and E? Superficial, transitional, radio, calcified. Wonderful. Wonderful. Wonder. Eh? A munasema transitional. Eh? Transitional, radio, calcified. So mumeanza B. Okay. Please know the zones of articular cartilage. Yes, start with tangential, then transitional, then radio, then the calcified. If you are too tired to remember that, why don't you just say superficial, intermediate, deep, and calcified? Kama zote. Superficial, intermediate, deep. Kitu inaitwa anatomy is very easy. You don't have to make your life difficult. If there is the easier route and it is the correct, use it. Superficial, intermediate, deep, calcified, and you have full marks. Aha. So identify the structure shown here and give a reason. What about E? Now E is the bone. E is the bone itself. Eh? Remember, articular cartilage covers bone. So E is the bone. Okay? It's the bone. What I might call a sub-articular bone. Okay, it's just bone. Yeah, subchondral bone. Aha. Let us go. So identify this structure. What structure is this? What structure is this? What structure? What structure? And please send the message to everyone. Don't send direct message to me. Peripheral nerve. Aha, very good, very good, very good, very good. Inayo, I've seen, I can see you guys are truly going to the histology lab, which is very good, eh? Very good, eh? You have utilized that 1 month of revision wonderfully. If you have been going to the histology lab, trust me, come Wednesday and Thursday, you will have something to write. You will write reason epineurium, okay? So, okay, I think this one is a straightforward one. This peripheral nerve, these are the nerve bundles themselves. They are covered by endoneurium, and then a bundle like that one. That's a nerve fascicle there, covered by perineurium, and then the whole nerve is covered by the epineurium as shown there. Okay. Okay. So that's the nerve, eh? The peripheral. Okay. Now here we are. Identify A, B, C, D. Yes. Guys, electron microscopy. You remember this? You must get a question on electron microscopy. You must. A, nucleus. Very good. A is the nucleus. C, mitochondrion. A, very good. B, rough endoplasmic reticulum. Wonderful. C, mitochondrion. Very good. D, Golgi apparatus. Wonderful. Yeah, ninaona you guys you guys are very, I can see you have gone through electron microscopy. It is very commendable. Okay, good work, guys. Keep it up, eh? Yep. Now, when it comes to the electron microscope, what my only ask will be this: just go and find out the electron microscopic features of a protein versus a steroid synthesizing cell. If you can tell us 4 salient features of each, then you are a very good student. Okay, so just be able to do that. Okay, so A is the nucleus. So what is this? What is the name of that? So how would you name E and F and G? So what is E? Nucleolus. Very good. Can someone remind us the parts? What are the various components of the nucleolus? What are the various components of the nucleolus? Hiyo hamtaki kutukumbusha? Various components. Wacha niwaambie ilikuwa page ngapi Kimanis, juu hiyo kuna siku tuliletewa tukifanya BSc na kuambia we just did not write anything, eh? So they can decide to give it to first years. Is the class being recorded? Yes, the class is being recorded, and the recording will be sent to the YouTube channel as usual. I will try to send it before I sleep. What are the components of the nucleolus? What are the components? Euchromatin, hapana. They were not those ones. There were some weird name. Ribosome RNA. No. There were some weird names. Let me tell you. Page 11. Page 11. That is okay. Where is that? Yeah. It had 2 parts. Pars granulosa. I can see. Pars granulosa and pars fibrosa. Those are those 2. Those are the parts of the nucleolus. So they can ask you name the parts of the nucleolus. Remember those 2 guys. Okay. Yeah. Okay. I've said page 11 in your Humanis histology. Okay. So what is F? What is F and G? What is F? What is F? Nucleoplasm. Wonderful. Wonderful. Nucleoplasm. Very good. What is G? Nuclear membrane. Very good. I think you guys are doing a good job in electron microscopy. Yeah? Okay. So name the muscles attached to A and B. So what muscles are attached to A? What muscle is attached to A? A, temporalis. Huyo. Toa hiyo. Toa. Temporalis. Toa. Wrong. Zero. Temporalis. 0. Retropterygoid. 1 mark. Very good. B, masseter. Naona munabadilisha temporalis bio sana, eh? Munabadilisha majibu venye munabadilisha watu huku nje. Eh? Okay. So A is retropterygoid, not temporalis. Temporalis will never attach to the head of mandible. Temporalis will attach here. Guys, so what is the name of that part? What is the name? What is the name of that part where temporalis attaches? Yes, coronoid process, eh? Coronoid process, not conoid. Please, coronoid process, because we usually ask you this, and some of you will write conoid. Conoid process is found in your clavicle and not there, so that is wrong. Conoid is in the clavicle. It's the coronoid process, eh? That is where temporalis will attach. B, you said masseter, very good. So What is C? Name C. What is C? And so it's the angle of mandible on the inner aspect. That is where medial pterygoid attaches. Wonderful. What is D, and what are some structures which pass through? Mental foramen, mental nerve, and vessels. Wonderful. Okay. So what is the name of this part? The name of that part? Yeah, this one. Now let me name it K. What is K? Mandibular notch. Wonderful. Or masseteric notch. What passes there? What passes above it? What passes above it? Masseteric nerve, masseteric artery, masseteric vein. Wonderful. Okay. Guys, muscular attachments of the mandible. That one should be even not at your fingertips. Should be more than on your fingertips, guys. There are some things which are, I don't expect you to, these are free marks. These are free marks. Please don't fail such questions. Okay. So name the malformations. What is A, B, C, D? What is A? What is A? We are almost halfway. Ichthyiosis vulgaris. No, wonderful. Ichthyiosis vulgaris. D, port wine stain. Okay. B, avidia. B, gynecomastia. Where? What is that? A, gynecomastia. Who told you this is a male? Toa. C, hypertrichosis. Wonderful. You guys can see you are doing a good job. Okay, so I think we are done with that. So what is the other name of D? What is the other name of D? What is the other name of D? Wonderful. Hemangioma, okay? Not never, no. It's a hemangioma. Hypertrichosis. Yes, you can see excessive hair. You can see this guy here. You see, guy has a lot of hair over there. Mhm. Okay. Okay. What is A, B, C, D? What is A? Hii sasa hii nayo nimewashika. No, hemangioma is the port wine. A, precaudal plate. Pre, not pro. What is pro? No. It's precaudal. Very good, not pro. Precaudal plate, wonderful. What is B? Primitive node. Okay, primitive node. Okay. Uh-huh. C, yolk sac. Okay, wonderful. D, connecting stalk. Can see you guys, you are doing a wonderful job, A wonderful job. Wonderful. Great. And so what is E? What structure is that? E. And then you tell me what F is also. What's E? What's E? Yes, E is syncytial trophoblast. Wonderful. What is D? Sorry, F. What's F? That's F, not a C. Yes, cytotrophoblast. Cytotrophoblast. Okay, cytotrophoblast. Yeah, I think you guys are. So E and F, where do they come from? Where do E and F come from? Where do E and F come from? Epiblast. Epiblast. Trophoblast. Okay. Nyinyi tu munanishtua tu. Epiblast. Nimeshtuka tu sana. Trophoblast. Okay. Okay. Ni sawa. Okay. So what is the embryological basis of these anomalies? What is the embryological basis of A, B, C, and D? Mhm. What is the embryological basis of A, B, C, D? A, extradigital rays. Wonderful. Wonderful. B, failure of apoptosis. Wonderful. C, C, C. What about C, guys? Undergrowth of cartilage. Hiyo kidogo ati WTF is C. Oh, but what is C? C is an alphabet. Overgrowth of sternum. Failure of fusion of sternum. Failure of fusion of sternal bands. Yeah, I think Lysencephaly has it. C is you can see there is that what is known as pectus excavatum. Excavatum. Okay, pectus excavatum. You can see there is a depression. There is a depression. There's a depression somehow. Yeah, or a stand of or a foramen, something like that. And it is due to overgrowth of costal cartilage. No, it's the basis here is failure of fusion of the sternal bars. During development, you have two sternal bars which meet at the midline to form one sternum. Okay. What about D? What is the basis here? Failure of the development of pectoral muscle. Wonderful. Okay. Wonderful. Okay. Okay. I know embryology. Yeah, I will ask you very many questions on embryology. What is A, B, C, D? Because I know this is where you guys get caught. Amniotic band. Okay. Amniotic band syndrome. Okay. What is B? Placenta previa. Very good. Could you please go back? Yeah, okay. Okay. Mwende, let us finish this one and then I go back. C, true note. Okay. D, micropenis. Umbilical knot. Okay, let us just say it's an umbilical knot. Yes, it's an umbilical knot. Whether it's a true one or a false one, okay, it's just an umbilical knot. D, congenital umbilical hernia. Hey, D, umbilical extrophy. Ayaje. Hypospadia, big testes. Hey, ma. Is that an anomaly? Allantoic cyst. Wonderful, 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 wonderful. Whoever said allantoic cyst? Au sasa ndo people are locked in. Wonderful. Allantoic cyst. You can see this. That's the allantoic cyst. At the base of the umbilicus, you have the allantoic cyst. Okay. Allantoic cyst. Can A be brachy? No, no, no. A is not brachycardia because you can see we have this band, amniotic band there. The fingers, the digits have been amputated. Okay, they have been amputated. They have been amputated. Okay, name A, B, C, D. What's A? Oh, I was supposed to go back. Sorry. So what was the question, Mwende? What was the question? I have gone back. What is D? D is part of the Poland syndrome. D is Poland syndrome. This is Poland syndrome. And there is in Poland syndrome, the pectoralis major muscle is absent. Pec major absent. How do you differentiate it from amastia? Oh, wonderful question. I can't differentiate that on an image because pectoralis major is, but there is a nipple here. If the nipple is present, okay, I think I'll have to to you see I think we can, let me see. If you know in amastia, pectoralis major muscle, in amastia, yeah, I think this is, we can clearly see the ribs here. You can clearly see that the muscle is absent. The muscle is absent. If it was just amastia, pectoralis major muscle would still be here, and the pectoralis major muscle, in that case, we wouldn't be able to see the rib cage as prominent as it is here. Okay? So here it's a more of the muscle itself is absent. This is part of the Poland syndrome. Is it sternal bands or bars? Both. Yeah, they are literally bars. You can also call them bands. Guys, the good thing about anatomy, we are not like biology where we will go even to, we just want to know, do you know the concept that how the sternum is formed? Okay, that is the concept you are looking at. We are not looking at how well can you write these words. No, we just want, do you have the concept? Yes, now you are, what is A, B, C, D? A, zona occludens. Okay, zona occludens, wonderful. What is B? Or the tight junction. Okay, what is B? Zona adherens. Okay, very good. Or there, adhering junction. B, desmosome. No, toyo. Remove that one. No. C, desmosome. Wonderful. C, desmosome. C, gap junction. Toyo. D, hemidesmosome. Wonderful. Okay. So you guys can see that you have a lot of work. You have not, and you take your Kemani's histology, page 16. Look at the lateral and basal specialization of epithelial cells. Please take your time, know about these lateral and basal specializations of epithelial cells. When you come to that dear pathology, you'll be taught very many skin conditions. And most of the skin conditions are due to defect of these junctions, these cell adhesions. Okay, so if you know where they are located, your work will be very easy. Okay, in that year in pathology. Okay, if you don't, my friend, pathology will become now a headache. Okay, so please. So A is the tight junction or the occluding junction, adherens junction or the adhering junction, desmosome, and the hemidesmosome. Let me ask this. Okay, what is this? Name E. What is E? What is E? Basal membrane. Okay, let us name it basement membrane. Which type of collagen do you expect to find there? Which type of collagen do you expect to find there? Kumbe mko wakali hivi. Mko wakali hivi. Type 4, wonderful, wonderful, wonderful. So type 4 collagen, let me see if pathology yenyu iko sawa. But this is also anatomy. So which abnormality is associated with type 4 collagen? Elaston. Hiyo ni nini? What is elastanos? Hiyo ni nini? Ehlers-Danlos. No. Good pasture. Huyu ni mkali. Whoever R is, huyo ni mkali. Marfan's. No. Marfan's is associated with Marfan's has something to do with elastic cartilage. Alport's syndrome. Whoever that dot person is, huyo sasa ndiye ako juu. Alport's syndrome. Wonderful. Wonderful. Huyo sasa just come and join for there. Okay. So, what is A? What is A? Anterior pituitary. Why andika tu anterior pituitary? Neurohypophysis, toa. No, remove that one. Neurohypophysis, no. Adenohypophysis, wonderful, great. Or anterior pituitary. Yes. Please note that anterior pituitary is cellular. Okay? That's why it is taking up the stain. Whereas the posterior one is fibrous. Okay? So neurohypophysis is fibrous. Adenohypophysis is cellular. Between the two, you have the interglandular clefts. Okay? Great. So what are the three parts? Name 3 parts of A. Pars distalis, pars intermedia, pars tubularis. Wonderful. Wonderful. So what are the parts of, if this was B, what are the parts? What are the parts of B? What are the parts? Pars nervosa, okay, what else? Pars nervosa, okay, what else? The infundibulum, okay, wonderful. The infundibulum and the pars nervosa, okay. Median eminence. Yeah, I also think median eminence is part of it. So what are the supporting cells in A? What is the name given to the supporting cells in A? What is the name of the supporting cells? What is the name of the supporting cells in A? Pituicytes. No. What is the name of the supporting? Wonderful. Folliculostellate cells. Folliculostellate cells are the supporting cells of the adenohypophysis. Pituicytes are the supporting cells of neurohypophysis. So B, this is where you find pituicytes, okay? Pituicytes. Then please remember, in the adenohypophysis, you have 2 cell types, chromophils. Now my pen is misbehaving. Chromophils and chromophobes. And then under chromophils, you have acidophils and basophils. Under acidophils, you have the lactotrophs and the mammotrophs. Basophil, you have the corticotrophs, the thyrotrophs, and the, which other one? Corticotrophs, thyrotrophs, and the gonadotrophs. Gonadotrophs. Please remember the secretions of each. Somatotrophs are the same as somatotrophs are not under basophils. Those are those acidophils. I thought lactotrophs and somatotrophs are the acidophils. Maybe you correct me. It's been a while since I checked that information. Okay, but all in all, just remember the secretions, okay? Just remember. So what are the secretions of B? What are the secretions of B? What are the secretions? Fibroblast. What are the secretions? None. I no. Vasopressin and oxytocin, those are the secretions. Okay, it just stores in supporting cells. Hmm. I don't think you have fibroblast in the. I don't think you have fibroblast in the pituitary. The supporting cells in A are folliculostellate, in B are pituicytes. Okay, yeah, okay. It stores oxytocin and vasopressin. Yes, after storing it, then what? It just stores it. Okay. I can see it's a matter of it is a matter of vocabulary here. It releases. I've been told it is releasing, not secreting. Okay, I agree. Okay, so the hormones there you'll find there is oxytocin and vasopressin. I won't ask you the actions, but please know the actions of those two hormones. Where are these hormones produced? Where's oxytocin produced? Where's vasopressin produced? Hypothalamus. Wrong, wrong. Wacha wewe. Wacha wewe. Eh? Eh? You are giving me the type of answers you guys give to those people who ask you, where are you from? And then you tell them you are from Nairobi. Where in Nairobi? Where? You can't tell me hypothalamus. Hypothalamus is a very big thing. Supraoptic. Wonderful. For vasopressin. Paraventricular nucleus for oxytocin. Wonderful. Now, if you tell me such answers, I know you have gone through the anatomy book. Hypothalamus is too big. You know, the hypothalamus also has those anterior nucleus, posterior nucleus, suprachiasmatic nucleus. But do those nucleus produce these hormones? No. Hypothalamus is big, big on spot, on spot. Aha. A, B, C, D. Inayo. Wonderful. Yeah, I liked this question. What is A, B, C, D? Simujibu. A, uncinate. 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 Uncinate fasciculus. Okay. C, cingulum. C, superior longitudinal fasciculus. Wonderful, Emmanuel. D, phonics. Toyo. Toa. Toa. No, no. A, insula. No. No. C, superior longitudinal. Wonderful. B, inferior longitudinal. Wonderful. Wonderful. A, uncinate fasciculus. Okay. D, cingulum. Wonderful. Wonderful. D is the cingulum. Kumbe, you can see you have used some combined efforts and you have gotten it. Combined effort. So A is uncinate fasciculus. B is the inferior longitudinal fasciculus. C is the superior longitudinal fasciculus. And below it is the cingulum. Please go and read about the fiber tracts, the white fiber tracts of the cerebrum. Okay. Sasa hiyo, is it one cerebral hemisphere? One dot. One dot. You should know about the association fibers. You should know about the association fibers. Not only association, go and also read about commissure of fibers, because next time they will point the posterior commissure or the anterior commissure or the corpus callosum. Corpus callosum tumeuliza mara mingi sana, hiyo mtajua. So this time you'll be asked posterior or anterior commissure. Know where it is located. Now these are the association fibers. Then also know the projection fibers. The projection fibers. Yeah, like this one. Which fiber is this? Which one are these? Let me name it as E. What is E? What is E? What is E? Ah, very good. Corona radiata. Wonderful. 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 Haya. Guys, if you have not read about the fiber systems of the brain, you are in a bad place. Okay. What is A? You know, the image does not look very, you can make it out. What is A? And the origin? A, left vagus, toa hiyo, 0. That's phrenic. That's phrenic. Okay, we can't say left phrenic. It's just phrenic juu zote mbili zimeneemiwa A. Okay, and the origin is C3, C4, C5 from the cervical plexus. Okay, I know you guys are nowadays munaandika left phrenic and whatever. No. As you can see, A is that one and also that one. So all of them, this is the right one, this is the left one. But okay, if you write left vagus or right vagus, not vagus, phrenic. This is phrenic, okay? This is phrenic. Please note that phrenic has a very intimate relationship with the pericardium, okay? Has a very intimate relationship with them. Yes, this is the reason why not vagus. It has a very intimate relationship with the pericardium. Vagus has no business with the pericardium. I'm seeing a recurrent larynge. Munaona wapi? Guys. No. You know, ati uko juu. No. No, guys, don't watch a kuforce. No. This is phrenic. Phrenic is the one which you can see it has a very close relationship with the pericardium over there. You can see the right one here, just coming to pass through the caval foramen there to go to supply the biliary tree. Okay, so that is phrenic, not vagus. What are the structures supplied? Hey, kwani mlikuwa mmeweka majibu on hold? You guys have the answers on hold. Okay, diaphragm, pericardium, biliary tree. Okay. Side this lung. Side this lung. Side, guys. Side. 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 Mudheu, nimeshika mmoja. I just knew there is someone who will do it. Mudheu. Toa hiyo, toa. Mudheu, toa hiyo. Okay? This is the left lung, okay? Left. That's the left lung. Not the right one. No. Not the right one. Please note, this is anterior. That's posterior. That's superior, inferior. That's the left lung. Whatever you are seeing here, this is medial. Whatever is on the other side is lateral. Okay, so ABC. What is ABC? Yes, this is another question which you should know. Hii nayo itakuwa, I can tell you that for free. When it comes to identification of the structures which make impression on the lung and the hilum structures, you'll be asked a question. It has always been asked. Even when I was at first state, it was asked. A, pulmonary artery. B, bronchus. Pulmonary artery. B, bronchus. C, pulmonary vein. Sawa. B, bronchus. Mbona mnaniangusha? Which bronchus? Segmental bronchus. Yes, principal bronchus, okay? Yes, principal bronchus. If you write left principal bronchus, now wonderful. Okay, guys, your answers should be complete. Okay, even you are complete. Same should apply for your answers. Okay. So what makes the impression here and here? Green, arch of aorta. Toa hiyo. Zero. Arch of aorta, zero. Descending aorta, red. Wonderful. Red, descending. Yes. The green one is ascending, not arch. Arch ako hapa. The arch is now here, between the two. But where green is, that's ascending. So, okay, now you can take a breather, eh? Now you can take a breather. Not a breather. Repeat. Where green is, that ascending, that is ascending. Where that is now where the arch of aorta is, and this is descending. Okay, what would make this impression here? This one. Let me name it O. What would make that impression? Very good. Esophagus. Wonderful. Esophagus. Esophagus. Okay. What would make this impression? Let me name it M. What would make the impression M? Left ventricle. Wonderful. Okay. Left ventricle. Wonderful. Okay. Yes. Now, this is just an image. I have just left this image here to show you the hilar structures, the arrangement of hilar structures, the structures of the hilum for both right and left lung, okay, and the impressions, okay, and the impressions. Please know everything regarding this. Please know everything regarding this. I will ask you again and again, please know the arrangement of structures at the hilum for both left and right, and the impressions. More so the impressions. You'd be asked a question. Yes, when you go for your marathon, you'll meet along there. You'll be asked something. Either the hilar structures or the impression. It's not like I'm giving you leakage. It is always the case. When I was a first year, it was done. When the class that followed me was done. The class, when I was doing BSc, they were asked. And I expect the same for you guys. I hope I get it. No, no, what do you mean you hope? You should get it. You should get it correct. If it comes, please get it. Free marks, those ones. Free marks. A to F. What is A? Guys, what is A? Very, very good. Jafar, very good. Jafar, very good. At the great cardiac vein. Toa yo, toa. That's the right coronary artery. What is B? What is B? What is B? Baby. What is B? Wonderful. Anjohi, very good. Not SA node, rather the AV node. It's the atrioventricular nodal branch. The atrioventricular nodal branch. Wonderful. Not the sino. The sinoatria is given off proximally, okay? Not at this point. What is C? What is C? Inferior vena cava. Okay. What is D? What is D? What is D? PDA, patent ductus arteriosus. Wrong. PDA ni nini? Please say what PDA is, not patent ductus arteriosus. Posterior descending artery, okay, or the posterior interventricular artery, okay. And remember, that artery is the one which determines the coronary dominance. If the posterior interventricular artery, as in this case, you can see this posterior interventricular artery is coming from the right coronary artery. So this heart would be said to have right coronary dominance, okay? If this artery, that posterior interventricular artery had come from the left coronary artery, that heart would be said to have left coronary dominance, okay? E coronary sinus, okay, E is coronary sinus. What is F? Finally, what is F? Middle cardiac vein, Middle cardiac vein. What is this? What is J? 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 Kwani mumenyamaza? Guys. Small cardiac vein. Toa hiyo. Toa hiyo. Great card. Toa hiyo. Marginal artery. Toa hiyo. Oblique vein of Marshall. Toa hiyo. No. Posterior vein of left ventricle. Wonderful. A vein. It's a venous vein. Okay. The posterior vein of left ventricle. Wonderful. Identify 1 to 9. What is 1? What is 1 here? Go back. Okay. So we have said this. You can see this structure. This is the posterior vein of left ventricle. You can see it's a vein because you can see it is draining to the coronary sinus. Okay, that's the posterior vein of the left ventricle. I hope I have answered. I have. Willie, have you been? Is it okay, or what did you want me to repeat here? Yeah, ideally. Okay, what I won't mention here. Oh, by the way, you want to take a picture? Okay. So what the heart? But regarding the heart, I have not mentioned very many things. We have just done the external. We have just done the external features. I've just shown you in fact, I've shown you the more of the arterial and the drainage, the venous drainage. For the heart, please, in your own time, please go and look at the internal features. Internal features. Especially, even if you sleep and you forget to revise the others, you shall not forget the right atrium, because you will be pointed that fossa ovalis, and questions will be, this is a derivative of what? They can point the opening of the coronary sinus and ask you what drains at that point. What is the name of the valve that guards that point? Then also look at the internal features of all the ventricles, okay, both right and left. For the left ventricle, they don't ask the internal features very much, okay. Also, please be able to differentiate an auricle from an atrium. At this point, I know you know the difference, okay. Please, this is I have not talked about the internal features. Also, I have not talked about the development. See, we did this with you guys, that session where we look at the development of the heart. Please go look at that heart tube, the heart tube. And remember what comes from those primitive atrium, the sinus venosus, the valvus cordis, the truncus arteriosus, and the others. Okay? Please take your time. These ones will be asked. There are some things which you will be asked. The probability of you being asked the development of the heart is very high. Okay? For the development of the vessels, that one they won't. Nobody will even bother you to describe how the superior vena cava is formed or how the inferior vena cava is formed, unless now you come back to BSc anatomy so that you can be bombarded with those details, very interesting details. So, but for the heart, you must know. For the heart, you must know. You must. So 1, I had seen 1, right subclavian vein. Wonderful. That's the right subclavian vein. 2, What's 2? What is 2? Superior vena cava. Wonderful. 2 is superior vena cava. 3? What's 3? What is 3? Intercostal arteries. Intercostal arteries. Toa hiyo. Toa. Intercostal arteries. Wrong. Posterior intercostal veins. Okay. But if you were to say right posterior intercostal veins, now that even would be wonderful. But posterior intercostal veins, we agree. Okay, we will also give you that. 4, what's 4? Azygous vein. 5. Okay, what is 5? What is 5? 5, interazygous vein. Wonderful. Wonderful. 5 is interazygous vein. What is 6? What is 6? 6 is up here. Left brachiocephalic vein. Very good. Left brachiocephalic vein. Wonderful. 7. What 7? What is 7, guys? Left subclavian vein. Wonderful. Left subclavian vein. Wonderful. What is 8? What is 8? Left subclavian. Please, it's left subclavian, not subclavian. Accessory hemiazygous. Okay, wonderful. Accessory hemiazygous. Superior hemiazygous. Siku hizi inaitwa superior hemiazygous. Maybe it changed. The last time I did anatomy, we used to call it accessory hemiazygous. Superior hemiazygous. Hey, is it? Maybe the renaming, maybe it was changed the name. I don't know, but the last time I checked an anatomy book, we used to call it accessory hemiazygous. What is 9? Hemiazygous, okay. A and B are just areas where variations occur, okay? I did not put, that one was not put to be named. It just shows you where variations can occur, okay? Variations can occur in those areas. Please be able to tell us, eh? Yeah, that is there. Yeah, I'm happy that you were able to tell us the name, eh? So what is this? What structure is that if I call it 10? What is structure 10? Yeah, that one. What is 10? What is 10? What is 10? Yeah, this is 10 here. This one, that structure there. Yeah, that's the right superior intercostal, okay? The right superior intercostal. I think A can be the left one, eh? Yeah, A can be the left. A is the left superior intercostal. Yeah, A is the left superior intercostal. Okay. We are about to finish, eh? I was to give you a break, but now, tumaliza hii kitu. A, B, C, D. What is A, B, C, D? What is A? What is A? Pterygoid plate. Wrong. Which pterygoid plate? Lateral pterygoid plate. Wonderful. Pterygoid fossa. Toa hiyo. Toa. A is lateral pterygoid plate. Okay. Lateral pterygoid plate. What is B? Pharyngeal tubercle. Wonderful. Full stop. Full stop. Pharyngeal tubercle. Full stop. Yep. That's it. What is C? Occipital condyles. Wonderful. What is D? What is D? Yes, D is the occipitomastoid suture. Okay, occipitomastoid suture. Sutures are very easy to name. You just look which two bones are articulating at that point. This is the occipital bone, that's the mastoid. So occipitomastoid suture. Wonderful. B, cleavers. No, no, no. Cleavers is on the inner part. Okay. The inner aspect is the one which is named as cleavus. On the outer part, that is the pharyngeal tubercle, where B is. That's the pharyngeal tubercle. What attaches to the pharyngeal tubercle, guys? What attaches to the pharyngeal tubercle? Pharyngeal muscles. The pharyngeal raphe. Wonderful. The pharyngeal raphe. Wonderful. Okay. Haya. So, si mnajua hizi foramen nazo, you will be asked these ones. These ones, you will be asked. You just wait. You will find them. So that was D, E, F, A. Okay. Let me charge this guy. So what is E? What is E and F as it charges? 5 minutes break. A. Okay, I think we can give you the break after this. E is foramen ovale. F is, what's F? Yeah, spinosum. And then I hope you know the structures which pass through, eh? Yeah, I hope you can be typing in the chat box which structures pass through as I give you that 5 minutes break. Yes, you know. Okay, if you know, no need to type which structures pass through. I hope you do know which structures pass through. Okay, you can take a 5 minutes break. It's 10:10. Come back at 10:15 for just another maybe 2 or 3 questions, and then we are done. Power on. Connected. The 5 minutes are over. Yes, we finished this thing, eh? I hope I'm still audible. Can you confirm that you can hear me? Okay, so let us just finish this thing. Um, okay, so I think we'll just remain in the few, very few slides. Hey, 10 more. What is happening? Okay, most of them are just, I think you had named this. I was to ask if that is F, what's G and H? What's G and H? And M, what's G, H, M? G, carotid canal. G, good night. Yeah. Okay, G is carotid canal. Uh-huh. What's H? H is stylomastoid foramen. Okay. What's M? What's M? M. See hapo M, E, whatever I pointed here, whatever I pointed, this one. That's rasaram, okay? Not jugular. Hey, that's not jugular, guys. That's rasaram, okay? Guys, I'm getting. You have already slept. That's rasaram, not jugular, okay? Please know the structures which pass through. Can you name the structures which pass through H? Name the structures which pass through H. Name the structures which pass through H. Facial nerve, stylomastoid artery. Uh-huh. What else? Yes. No, this is the thing which, no. Emisal Yanan, stylomastoid vein. Great. So stylomastoid artery, vein, facial nerve. Emissary, not everywhere you meet a foramen and the first answer you put is emissary. No, that one, no, no. Ati ya nani? Labda yake. What's A, B, C, D, E? Uh-huh. A, pulmonary agenesis. Okay. Pulmonary agenesis for A. B, okay. D, diaphragmatic hernia. B, pulmonary hyperplasia. Okay. C, okay. B, pulmonary hypoplasia. Okay. C, bronchial cyst. Toa. C, bronchogenic cyst. No. CPAM. Okay, yeah. C is CPAM, congenital pulmonary airway malformation. E, pulmonary artery sling. Wonderful. Yeah, I think, yes, CPAM is congenital pulmonary airway malformation. Yes, and you can see in this lung here, you can see that the lung is multicystic. You can see very many cysts, okay? In fact, those are not cysts. It's the airways which have dilated abnormally, okay? So B is pulmonary hypoplasia. B is pulmonary hypoplasia. What are the two varieties of D? What are the varieties of D? What are the two types of D? Yes, Botcharek and Mogagni. Okay. So Botcharek hernia and Mogagni hernia. Guys, please, be able to tell the difference, but it's not here, okay? Can be asked in an MCQ. What is the difference between Botcharek and Mogagni? Okay. I think I have just gotten this image from explain CPAM again. In CPAM, the lung is usually filled with very many cysts. The lung is multicystic. You see, these are not cysts, they are pseudocysts, okay? You can see they are not cysts because they are not fluid filled. Rather, they are pseudocysts, and it is due to there is expansion, there is this fusiform dilatations of the airways, okay, of the um, intrapulmonary airways. Those airways within the lung, they tend to dilate abnormally. And that is now what is known as congenital pulmonary airway malformation. Okay, so the airway which is malformed to form pseudocyst. Okay. 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 I think I hope I think Rudy I am sure. Which one? Which one? Which one did I say the last one? Which one specifically should I repeat? Hey, okay, I think I have already. Yeah, I think I just put this image here to show you the various anomalies of the limbs, upper limb, and I won't, you just at least know the basis, okay? Just even go know the basis, eh? But those are the names. Here, now this is a very important how to differentiate focomedia and meromedia. In focomedia, the issue is the arm and the forearm. The hands, you can see the hands are okay. Okay, the hands are fine. Okay. The issue is the forearm and the arm. That is where there is marked shortening. Melomedia, you can see that all the three parts are affected equally. Okay, all the all the three parts are affected equally. Also here, all the three parts are affected equally. Okay, but you just know this is meromedia for comedia. Hizi images watakuletea tu hizi images, you know, these guys, trust me, they are very, these images are from the internet, so you find them easily. Now this one, eh, even if you forget everything regarding the kidneys, I will ask you, please be able to one side a kidney. Side a kidney. And siding a kidney is the easiest thing. First, just know where the hilum is, that's medial, okay, that is lateral. Then, how do you identify anterior, posterior? Just look at the hilum. Remember, the anterior most structure is the vein, then the artery, and then the renal pelvis is the most posterior. So look for the renal pelvis, where it is, that is the posterior. Then how do you identify superior and inferior? Hii mambo mingi ati, oh, you know, when I came to the lab, hiyo siku ya kidneys, I was asking guys, how do you identify superior and inferior? The superior one is, I don't know, it's more pointed. It's, I don't know what. Okay, okay. That is good to know. Just the easiest, just look at the direction of the renal pelvis. The ureter will always go inferior. There is no day the ureter will go superior. So wherever the ureter is headed towards, you know that is inferior. Okay? And you are able to side a kidney. Then after siding, please know the anterior and posterior relations. These are the anterior relations. I won't touch on them. I won't. This one, the best way to see if you have gotten the relations, go take a blank page, draw a rough sketch of the kidney like that, and then shade. You shade there, you say this is where I expect to find the adrenal, this is where I expect to find this, this is where I expect to find this, this is where I expect to find this, and this. That way, that by drawing, you will have gotten them. Because trust me, there is no need for me to tell you, oh, it would be, it will be there. It will be there. Okay. And also for the kidney, please know So if I point, let me see. If this is A, and then I ask you, can you name A first of all? Name A. What is A? Ureter. Very good. Ureter. And then, okay, left ureter, sawa. Left ureter, no. Okay, sawa. What is the derivative? It's a derivative of what? It's a derivative of what? Ureteric bud. Simple. Ureteric bud. Simple. Yes, that way. You just keep it simple. Okay? I know some of you start saying mesonephric, diverticular, whatever. I told you if there is an easier option, use that. Okay? Ureteric bud is easier to remember. And then they can point the kidney itself. Okay? And then, okay, for the ureter, please remember the areas of constriction, okay? The areas where you find constriction, four of them, the 4 areas. Please be able to tell us the 4 areas. I won't ask you that. B is the kidney, is the derivative of what? Where does kidneys come from? Yes, metanephric blastema. Don't tell us intermediate mesoderm. Intermediate mesoderm is vague, okay? Metanephric blastema, now that is wonderful. Posterior relations, I think by now you should know these things. Okay, please be able to tell. Are they asking anterior or posterior relations? Okay, and you will use the renal pelvis to know is the pin on the anterior or the posterior surface. This is another one, which I think by this time, if you don't know the relations on the visceral surface of the liver, then you are in a very dangerous place. You are in a very dangerous place. Okay, please know the relations of the visceral surface of the liver. Okay, let me leave it at that because the number of questions you'll be asked here. So what is this structure? What's A? And then what's B? What is A? What's A? Ligamentum teres hepatis, okay? So it's a remnant of the umbilical vein. What's B? What's B? Ligamentum venosum. Wonderful. It's a remnant of the ductus venosus. Can see, go back. This one, the posterior relations of the kidney. I've gotten this image from the internet. Just Google posterior relations of the kidney. This image will pop up. Okay. Spleen, the same. What else about the liver? Oh, for the liver, I've not even talked about the histology. Oh, wow. So what is the functional? What is the functional unit of the liver? What's the functional unit of the liver? Functional unit. Hepatocytes. Hepatocytes. Haptocytes. Hizo ni nini? It's the hepatic acinus or the liver acinus. Guys, acha tufungue hii Kimani yetu. Kimani's histology. I can't remember it was page what. Let me see. Yeah, I think page 142. Yeah, page 142. You'll see the 3 types of lobules. We have the classic lobule, the portal lobule, and the liver acinus of Rappaport. Okay, so guys, by this time I expect you to know the functional lobules. Okay, which is the anatomical one, which is the functional one. These things, guys, these are the things where marks are literally in page 142. Yes, page 142, that is where the marks are. Please read extensively. Read extensively on the histology of the liver. And if you have any questions regarding the histology of the liver, Aaron Sami did a project where he investigated how vitamin B9 affects the structure of the liver. He has made over 1,000 slides on the liver. He's an expert there. Okay? He's an expert there. So, questions, sukumia Samie maswali za liver histology, kujibu. Okay? Kujibu. Don't go to ask him obvious questions. First, read your Kimani's histology, and then you can now go and ask questions. You can also ask me, but I'll have to confirm first with him or with the book before answering. It's been a while since also myself, I went through the histology of the liver, but I can tell you, they will ask you very many things regarding the histology of the liver. Okay. Ati, what do you call this YouTube channel viewers? You mean this guy anamaliza first year na hata ajui YouTube channel yangu? Wow. Hey, it's made content. Okay. Hey, no, I don't blame him. Maybe he's a fan of this guy from Egypt. Maybe he's a fan of that guy. Okay. It's made content. Yeah, I can see someone has told you. I will put the video there. I hope you have seen these relations. Yeah. Spleen, ndio hiyo. Relations, left colon flexure, stomach, left kidney. Yeah. Please, guys, know these things. Also know the histology. Also know the histology of the spleen. Please be able to tell us the spleen is made up of when discussing the histology of the spleen, very simple. Stroma, parenchyma. Stroma, capsule, and trabeculoid. Parenchyma, two components, red pulp, white pulp. Red pulp is made up of the splenic cords of Biroth. White pulp is made up of lymphatic follicles. Those lymphatic follicles which have that vessel at the center, the perivascular lymphatic sheath, which is composed of the T cells, and germinal centers, which is made up of B cells. Please, guys, take your time to know the histology of the spleen. If you have any questions regarding the histology of the spleen, contact, do you know Gloria Natalia? I'm sure most of you don't know her, but she did a project on the spleen. So she is the spleen expert. She knows everything. Yes, if you know Gloria, contact her. If you have any questions regarding the spleen, contact her. She will tell you everything which you need to know about the spleen. Ati, what about myself? Okay, I did the retina. So if you have questions on the retina, you can ask me. Haya, 1 to 12. As we come to an end, 1 to 12. Simjibu bwana. 1, urinary bladder. Okay. 2. So as 1, yes. So urinary bladder, where does it come from? What is a derivative of what? Relaxing here. 2 ni prostate. Okay. Cloaca. Cloaca. Wewe utawaka wewe. Cloaca. Urogenital sinus. Ni sawa. Cloaca. Ni sawa. 2 ni prostate. 3, what's 3? Pubic symphysis. Okay. Cloaca. 3 is pubic symphysis. 4. What's 4? Cloaca. 4 external urethral sphincter. External urethral sphincter inafanya nini chini ya prostate? External urethral inafanya nini chini ya prostate? Corpus. Okay, we can, I think corpus. Corpus. Okay, 5 urethra. Which part? Which part? Which part of urethra specifically is 5? Membranous. Okay, okay, we can agree with that. Okay, 4. Tuachane na 4 for now. I will tell you what 4 is. But I like whoever said corpus gland. Can be that or something else. 5. Okay, mmeniambia 5. 6. What 6? 6. Guys, what is 6? Vas deferens. Toa hiyo. Vas deferens, toa hiyo. Testes, okay. Okay, 7. 7. Epididymis, wonderful. 8. What's 8? Scrotum, nice. 9. What's 9? Tunica albuginea, okay. Tunica albuginea, okay. 10. 10. What's 10? Corpus cavernosa, wonderful. 11. What's 11? Glans penis, okay. 11 is glans penis. 10, 12, rather, 12. What's 12? External urethral sphincter. External urethral meatus. Urethral opening, okay. So my answers ziko tu hapo, okay. Ziko tu hapo. 4 is seminal vesicles according to the source. Wejua majibu zimetoka mbele. According to them, 4 is seminal vesicles, okay. Okay. So wejua majibu zimetoka mbele, okay. Okay, 1 to 17. What is 1? What is 1? Yes, 4 according to the source is seminal vesicles. According to the source. Okay, 1 fallopian tube, okay. 2. 2. Yes, 1 fallopian tube. 2 ovary, okay, ovary. 3. 3. What's 3? What is 3? Uterus. Uterus. Fundus of the uterus. Fundus. Uterine wall. Sawa. Zote ziko sawa. Hata ukiandika myometrium iko tu sawa. 5. Sorry, 4. What's 4? Uterine cavity. Sawa. Uterine cavity. Mwingine akisema the arrow has not pointed the cavity yake endometrium. Sawa. 5. What's 5? What is 5? 5. External os. Toa hiyo. Toa. What is 5, guys? Ectocervix. Yes, 5 is cervix, cervical canal. 5 is the cervical canal. What is 6? What is 6? 5 is cervix. Yes, 6 is now internal os. 6 is the internal os. What is 7? What is 7? What is 7? Ah, what is 7? Eh, what is 7? Posterior for ectocervix. Wonderful, Jafar. That's ectocervix now. Okay. So kidogo muone majibu. So cervix there, endocervix, ectocervix, all that. Uh-huh. 8. What is 8? Kwani kila kitu ni no. 6 is endo. 6 is endocervix. Then 5 is the cervical canal. 7 is the ectocervix. Yes, 8 is the vaginal canal. Okay. 9. What is 9? 9 iko wapi? Oh, okay. What's 9 there? Yes, bladder. Okay. 10. What's 10? Urethra. Okay. 10 is the urethra. 11. What's 11? What's 11? External urethral orifice. Okay. 12. What is 12? What is 12? What is 12? Labia. Which labia? Minora, majora. Minus. Minus hiyo, hapana. Majora, okay. Minora, no. 13. What's 13? What is 13? Yes, 13 is the clitoris. Okay. 14. 14. 14. What is 14? Pubic symphysis. 15. 15. What is 15? Sacrum. 16. 16. Coccyx. 17. 17. The anal canal. No rectum. No. Kuna rectum up. Hiyo anal canal. Rectum is this. At this point, it's already anal canal. Haya, hizo muende sasa muangalie, muone where pale mpata shida. Okay. Now the second last question. Identify the receptor shown, given reason, name the sites and the modality. So please go back. Rectum is that one. At this point, it is already the anal canal. Where 17 is, that's the anal canal. But now this above it, now this is the rectum. So that's the rectum. Okay. And then please know let me ask you this. In fact, I don't know. 12, can you tell me? It's a derivative of what? 13 is a derivative of what? 3 is a derivative of what? So 13, answer 13. 13 is a derivative of what? Genital tubercle, wonderful. Genital tubercle, wonderful. 12 is the derivative of what? Labioscrotal swelling, very good. Okay. Genital swelling, okay. 3 is a derivative of what? Meridian duct, Meridian duct. Okay. Yeah. I had seen a question. Was there whoever had written a question in the chat box and you type it, because these chats are too many. Difference between os, ecto, and endo. Okay. So consider the let me use a drawing. Consider that is the uterus. And then the cervical canal is usually a narrow opening, which now leads to the the vagina, okay? So let me draw something like that. So if this is the uterine cavity, and this is the vaginal canal, this here is the cervical canal, eh? That's the cervical canal. Now the opening to the vagina, that's the external os, eh? Or the ectocervix. And the opening towards the uterine canal, that's the internal os or the ectocervix. Iko sawa? Iko sawa, whoever had asked that question. Is it okay? Have I answered your question? So they are the os and ecto. Yeah, I think they are the same thing. Oh, I thought you were asking the difference between endocervix and ectocervix. No, apparently. Eh. Okay. So, but the book was a jibini, guys, so that I can know if I will sleep. Mesenkai, toyo. Vaccinian corpuscle, wonderful. That's the vaccinian corpuscle. You can see vaccinian corpuscle there. Ah, yeah. So, uh, why vaccinian? Because of that. I know you can't see the onion ring appearance, onion appearance, but if you look keenly, you might see it. Eh? You might see these concentric rings. Okay. So where is it located? Where do you find it? Where do you find it? Okay, dermis. Where else? Where else? Where else do you find it? Mumesema dermis. Oh, sawa. Where else? External genitalia. Okay. Okay. Nipples. Okay. Okay. What modality? What modality does it? What modality? What modality does it convey or perceive? What modality? Fine touch. Hey, fine touch. Vaccinian corpuscle. Bro. Fine touch. Hey, pain. If you write that, you'll be in pain. Hey, pain. Vaccinian corpuscle, pain. You guys are paining me. Hey, fine touch. Fine touch. Proprioception. Okay. Deep pressure. Okay. Vibration. Okay. So you can see the locations. Subcutaneous connective tissue, ligaments, joint capsules, nipple, pancreas. Even the pancreas itself has it. External genitalia, mesentery, serous membrane. And those are the modalities. Pressure, vibration, crude touch, not fine touch. What's A? B, C, D. What's A? B, C, D. What's A? As we come to an end, carotid sheath, wonderful. Go back. A. Yes, the other name is corpuscle of Vata Pacini, but no, that's like Pacini and corpuscle na uendele. Okay, A, you had said carotid sheath. Okay, B, what's B? The current laryngeal. Okay, what's C? What is C? What is C, guys? Trapezius, trapezius. Okay, what is D? What is D? Sternocleidomastoid. Okay. So what would that E be? And F. What's E and F? What is E? Guys, what is E? E, anterior and middle scalene. Do you agree with that? So E is anterior scalene, F is middle scalene. Eh? Okay, so you can see these are the brachial plexus. You can see that the brachial plexus is located between those two guys. Eh? Okay. I don't think they can ask you to name these other guys, but please know the strap, the strap muscles of the neck. Those ones they can give you on a cadaveric image to identify the strap muscles of the neck. Yeah, do I have anything else? I don't have anything else to tell you apart from this quote from one of my favorite movies, The Dark Knight. The night is darkest just before dawn. I promise you, the dawn is coming. Right now, you might see life is difficult as you are approaching to do your end of year. Okay, life is difficult as you approach to do your end of year. You must revise. You must devise constantly. Yes, that's it. That's the pressure. That's the pressure. But trust me, that the pass list will come, and you see your name on that pass list. Ah, you'll be you'll be very happy. I tell you, okay? You'll be very happy to see your name on your pass list, okay? Uh, hizi maswali ni mingi. Let me see the ones which I can. No, comments ndizo mingi. Okay. Um, thank you, BSC. Well, I'm just Wallace. Hii BSC mnatoa wapi? Just Wallace is good enough. I feel so uninformed. Oh my God, any advice? What do you mean you feel so uninformed? You just study. You just study and you will be fine. The advice is you study what has been taught. You know the must knows. Eh? And whatever I've been teaching you right now are the must knows. Became Horace. Became. No. Okay, became. Thank you, thank you, thank you, guys. Also, thank you, thank you. Mm, You are literally the best. Yes, you too. Thank you, thank you, thank you. Today, please don't ask any. No, today I won't take any personal questions. No, no. Today, no personal questions. No, sitajibu hiyo. No, hiyo unanirushia direct message. No, hiyo sitajibu. Uh, about internal os. What was it? No, internal os is on the inner part. Is on the inner part from the opening of the inner opening of the cervical canal to the uterine cavity. That's the internal os. External os is the outer one. Now towards the vaginal canal. Ukituomba kura hatutakunyima. I don't think I'll campaign. Na campaign is for other people. Can you tell which questions can come for these years end of year? Aye. Even if I did know, siwezi kuambia. No, no. Enda soma kijana. Soma kijana, okay? Someni, okay? Someni. Lakini mtakuwa tu sawa. I think, I finished my end of years on Friday. Now this week I just have oral exams. On Friday, sorry, on Wednesday and Thursday, I think I'll pass at the department nione venye tu muko. Okay? Nione venye tu muko. So that we can talk. Eh? Tell us some topics. Tell us some topics we should focus on at least. No, you focus on everything. You see, I've also focused on everything. I've taught limb anatomy, neuroanatomy, head and neck, thorax, solid organs. Solid organs kwanza hiyo lazima, heart, lungs, liver, kidney, spleen, hemipelvis, those ones. Hizo ziko. Internal, tunaweza ongea. See, we are talking. Kwani what are we doing? Proceeding to fourth year or fifth. I am very young. I'm just going to fourth year. But now this is my fifth year in this institution. Ectocervix stroke external os. External os. Yeah, I think those two terms can be used interchangeably, but I'm being told there is a minor difference. But, I have been using them interchangeably. Question 1. What do you mean question 1? What do you want about question 1? Okay. And as I've said today, no, I will not answer those personal questions. No. Okay. So I don't think I have anyone. We love you. Oh, me too. Upcoming MSc. I will decide about MSc later on. Yeah, you are welcome. I hope success, guys, in your exams. Just as I always tell you, be calm. Okay, even if you go to the exam room and you are tense, just first calm down. Calm down, and then you start the exam. Take deep breaths. You deep breaths, and you'll be fine. You'll be fine. Otherwise, I was also tense when I did my end of year in first year, and the thing is just find some composure. Okay, find some composure. Utuombe. I am praying for you guys, and you are welcome. Okay, you are welcome. I would send the recording to the YouTube channel, Med Content. If you have questions, you know my number, my WhatsApp number. Since I don't have any exams nowadays, if you text me within an hour, I will answer your text as long as it's not between 12 and 6 a.m. because that time I'm sleeping. So after 6 a.m., okay, I do not, okay, please don't text the morning hours. I don't have the habit of looking at text in the morning hours. But after in the afternoon and in the night time, I will answer your questions very fast. So success, guys, in your exams, and I just pray that we will find each other in ANH. That is my pray that come next year we bump to upon each other in the corridors of Kenyatta. And if things don't go as planned always, I will tell you this. If they give you a retake, just accept it and go back as early as you can. That is my advice. Some people are given retake and then they will come at the end of semester 2. That is when they are accepting that they were given a retake. No, if it happens, just join with the first years and start with them afresh. Start with them afresh. Okay. It's the first time you are doing anatomy, and there is no shame of you failing it for the first time. Okay. There is no shame in that. Okay. So, but my play is that all of you be on the pass list, and that way life can move on. Si rahisi kubakia haki. No. These things, I know it's not easy, but that if that is what life has presented, you just just take it and deal with it. I think I have answered everything. I think I have answered everything in the chat box. I think I have answered everything. One new message. Retaking means doing all those cuts or end of year only. No, retaking means you do everything, not just end of year. You do everything. You do even the cuts and you attend the lab sessions and whatever. Ukiwa model 2 retake unalipia ngapi? No, I really don't know about fees. I really don't know about how much they pay. I even, since the fee structure was dismantled, I have no ideas even how much you guys are paying. So I don't think I am in a position. They will just tell you. But for now, don't focus on retaking. For now, we are focusing on giving it one shot and we won't miss it. Just one shot and it is enough. Okay, others have done it, you can also do it. So just on Wednesday and Thursday, just come prepared. Do not let the devil lie to you that you can cheat your way through. No, if I find you cheating, we won't talk. I am very strict when I find people cheating. I will directly take you to prof, the, the chair, the chair of department. No, please don't let the devil lie to you that you can cheat in anatomy. No, it's better you fail, but you did your honest work. Okay, rather than pass and then you are dishonest. No, okay. Please do your honest work. Okay. Kuna retake ya BS behavioral science. I really don't know. I really don't know. I don't think there is. Hey, kwani how bad was behavioral science that you are thinking about a retake? I don't think there is a retake in behavioral science. In fact, let me stop recording this because now all these shenanigans will now be found in YouTube. Okay. So I think, DKM, I don't know these things, guys. Unless I consult, I really don't know. Okay, so I think we can finish it there. For those who text me, continue asking me questions. I will answer them. And